Welcome back. Now we are going to learn about blood vessels. Okay. So when we're talking about blood vessels, we're going to have arteries. We're going to have large arteries, which then are going to branch into medium-sized arteries. And then the smallest arteries are called arterioles. And then our arteriole will go into a capillary. And then draining out of a capillary, we're going to have the smallest of the veins, which is called a venule, and then they will join together to form medium-sized veins, and then they join together to form our largest veins. So I know some of you think arteries are everything when you look at a model or drawing that is red, and veins are everything that are blue, but that is not correct. There are arteries that are blue and veins that are red. So let's get the definition correct. An artery is a blood vessel that is carrying blood away from inside the heart. So if the heart is pumping blood into a blood vessel that's carrying blood away, it's an artery. And so arteries are named for the organs where the blood is going to. So for instance, the splenic artery is carrying blood to the spleen, ovarian artery to the ovary, the temporal artery to the temple of your head, okay? And so if arteries are carrying blood away from the inside of the heart, then veins are carrying blood towards the inside of the heart, and they're going to be named for the organs where the blood is leaving. So the splenic vein is blood leaving the vein, leaving the spleen, going to the heart. Ovarian vein, blood leaving the ovary, etc. And the capillary then is where the work is done. It's the exchange site between the blood and the tissue's extracellular fluid. So dropping off the nutrients, dropping off of oxygen, picking up carbon dioxide, picking up other wastes. So when you are looking at your body and you're seeing these little blue things here and you're going, oh, those are veins, they contain blue blood, I want you to realize in humans, all of our blood is red, okay? Crabs, they have copper in their blood. So yeah, they have blue blood, but we have iron, as we discussed in the section on blood. So we have red blood. So yes, most of our arteries, we have a bright red blood, whereas in most of our veins, because we have given up some of the oxygen, it's a darker red color, but it's still going to be shades of red blood everywhere in our body. All right. The next concept I want you to realize is that arteries and veins and arterioles and venules are usually companion vessels. So think of it like two-way streets, okay? You've got an artery going this way, and its companion vessel is the vein going the opposite direction, and they tend to travel next to each other, okay? And notice the arteriole and the venule right next to each other. They're not going to be exactly the same size. So it's not like the 405 or the 10 highway where you have the exact same number of lanes on each side. Okay. But notice how much larger they are compared to the little capillary that is nearby. We'll talk about that shortly. Oh, actually, we'll talk about it right now. So remember, the capillary is what's connecting that arteriole with that venule. And actually, it exists as a capillary bed. We have a little arteriole coming in, and then it's going to branch. Because otherwise, think about it on a highway. If we have a big artery getting narrow, going all the way down to a skinny little one-lane thing, think of what would happen to traffic. It would back up. So instead of just going to one little narrow thing, it's going to branch into a bunch of different capillaries so that blood flow can continue. It's not going to back up into the artery, but blood flow through each individual little capillary, because they're single little lanes, that's going to be slow, but we're still going to be able to handle all the blood flow coming in at the same time. When we look at any one capillary, And what you look at it, what you will notice, it is one squamous cell layer thin. Okay, the wall is very, very thin. It is a squamous cell. Okay, that is the thinnest type of epithelium we learned about. Okay, because the epithelium is on the inside, because remember, epithelium not only lines the external surface of your body, but also lines every internal surface of your body. So the inside of a blood vessel is an internal surface. Here, we're not going to call it epithelium because it's on the inside. We are going to call it endothelium. So it's a squamous cell endothelium. And because squamous is the thinnest, this is best for gas exchange. And it does have a basement membrane there. Other things about it, the capillary is so narrow that red blood cells must travel single file. So this slowness helps promote, gives enough time for the gas exchange to occur and gives enough time for nutrient exchange from the plasma to occur. And also because remember, CO2, 70% of it is carried in the plasma as carbonic acid. So most CO2 gas exchange is happening from the plasma, not from the red blood cell itself. All right, looking at arteries and veins. Okay, so this is an artery and this is a vein here. And when I am done with this section, I want you to come back to this picture and come up with at least 3 ways that you can tell which one's the artery and which one's the vein. Don't just fall on 2, because 2 are very easy, but come up with the 3rd one. Okay, so arteries and veins both have 3 layers. If you were taking anatomy, you'd have to know the names of the 3 layers, but this is not an anatomy class, so we're just going to learn basically what each of those 3 layers contains, the most important things in each of those 3 layers. So the innermost layer contains that endothelium, that simple squamous epithelial layer we talked about in the capillary. So notice, capillaries are not here. Capillaries don't have 3 layers. Capillaries only had endothelium. Okay. So arteries and veins are much more complicated than capillaries. So the second layer for arteries and veins contains smooth muscle and elastic tissue. And then the outermost layer is loose connective tissue, and this is how the arteries and veins actually connect to whatever tissue they are connecting to. So let's look about arteries first. So you have to remember with arteries, this is the blood being carried away from the heart. So we have very big arteries close to the heart. So when the heart is pumping, it's dumping like a 1/4 cup of blood at a time. So those arteries need to be able to go, whoa, and expand, handle a whole bunch of blood at once, but not just expand, but to contract back down. So they need a lot of elasticity. Okay, now all the arteries need elasticity as they're going along, but the ones closest to the heart need a lot of elasticity. Okay, but as we will see shortly, the smallest arteries are the ones that are going to be controlling the blood pressure, and they're going to do it not with elasticity, but with smooth muscle. So they're going to be needing a higher ratio of smooth muscle, which can contract to raise blood pressure. So when we're looking at a typical artery, okay, so they're all going to have endothelial layer here on the surface. And this is not a high power view, so you can't see the endothelium because I wanted to show you other stuff. So what you can see here is we've got the areolar connective tissue here on the outside, and we've got this thick layer here in the middle. And this is a special stain for elastic tissue. So we've got this thick layer of smooth muscle here in the middle in the artery. So that can contract down if we want the diameter of the artery to decrease, as in vasoconstriction, or if that smooth muscle relaxes, as in vasodilation, then that would increase the blood flow through that blood vessel. But this dark black on both sides of the smooth muscle is showing the extra elastic tissue that we only find in arteries and not in veins. But in those arteries that are closest to the heart, what you will notice is that that extra elastic tissue goes all the way through that smooth muscle. Do you see how all of this is elastic tissue? So this is in the aorta, right coming out of the heart, and its first branches are all going to look like this as well. So now looking at those arterioles, you can see how it has a very thick wall that is mostly smooth muscle. Okay. And because of that, the lumen is small. And so when we look at arteries, they tend to have a thicker wall and a smaller lumen than the companion vein will. So looking at veins, remember we're going from artery to a capillary, well, artery to an arterial to a capillary to a venule to a vein. And so when we look and we compare here, you can see that the wall here has less smooth muscle and it's going to have less elastic tissue, or in the smaller veins and venules, no elastic tissue whatsoever. So thinner walls and a larger lumen than companion arteries. And because there's no heart behind the veins at the capillary bed to pump the blood, this is a much lower pressure system. So there's got to be a different mechanism for blood flow to return blood in our veins back to our heart. And that is going to be relying on your skeletal muscles. So think of your legs and your arms. With gravity, all that blood is down there in your feet and your ankle. But as you walk or you contract your skeletal muscle, that's going to push the blood up towards your heart. But then when you stop, it would go back down, except for the fact that your veins have valves in them. And the valves, as soon as there's backflow, those valves will open up and prevent any further backflow against the flow of gravity. So you're going, okay, Dr. Powell, that works great for the legs and for the upper extremities. But what about the chest and the abdomen? Well, when you breathe, those skeletal muscles are contracting and they're creating pressure gradients in your abdomen and in your chest. And that is how the blood is returning to your heart there. So, because it's a lower pressure system than in your arteries with the heart pumping behind it, about 70% of your blood at any one time is in the venous system. So it's not a 50-50 split. It's not fair, is it? But what this means is your venous system acts as a blood reservoir. So in times of blood loss, when you are stressed with sympathetic nervous stimulation, when you have vasoconstriction going on in your veins, you can actually return some of this blood back to your circulatory system, which is a good thing. All right. So the last thing I want to talk about is varicose veins. So kind of get an idea what you think this looks like, because when I say varicose veins, pretty much everybody has an idea what they're talking about. So think what you think this might look like, because varicose veins are occurring because there's a high venous pressure. Because, like I said, normally it's a low pressure system. Well, now it's a high pressure system. And this comes about from standing all day with a job, or repeated pregnancies, or because you have twins and triplets and all that kind of stuff, or obesity for many years, or some heredity cases, or people who have had clots in their venous system, for instance, if they travel on airplanes a lot and so they have clots in their legs. And by standing, it could be people who have jobs that require them to stand, like for instance, maybe they're a banker, Or maybe they work at McDonald's and stand for 8-hour shifts, or they're cashiers, or maybe there are neurosurgeons that stand for, or lawyers that have to stand for many hours a day. So it has nothing to do with socioeconomic groups. There's lots of different reasons why you might be required to stand for many hours a day. So do you have an idea of what this might look like? Okay. Well, for whatever reason, what's going to happen is those valves I talked about with that high venous pressure, they're going to be destroyed. Have you changed what you think this might look like? Is this what you came up with? Okay, so because this isn't it. Yeah, okay. These might be kind of unsightly, but these are not really a health hazard. Okay, so these are not varicose veins. So to think about varicose veins, think about what happens with little streams and little rivers, like when there's massive amounts of rainfalls, 12 inches in, 6 hours. What happens to that little stream? How torturous does it become? Okay. Think about all that water pooling in that stream. So think about what's going to happen if you have that little vein and now you have all that blood pooled. You have 2 or 3 times the normal amount of blood pooling. What's that vein going to look like? Have you come up with a picture yet? Does it look something like this? Okay, so the drawing looks bad enough, right? Okay, and so now everybody's thinking, oh, this is in women, this is in women. So of course, so then I had to take pictures and find pictures of varicose veins in men, because I want you to realize this not only happens in women, but I named quite a few jobs where it can happen in men as well. These are varicose veins, okay? So these require treatment. All right, with that, we are done with this section and I will see you soon. I think we're going to come back and talk about some heart anatomy. All right, so thank you once again for all your hard